Afternoon, everyone. Sorry for my bad throat. Myself, Anil, I'm my today's topic is effects on the optic nerve sheath diameter in patients undergoing laparoscopic cholecystectomy maintained with desflurane versus propofol. The pneumopericardium, which is created during laparoscopic surgeries, leads to increase in CO2 retention, causing vasodilation of the cerebral vessels and thus increase in the intracranial pressure. Currently, to measure this pressure, invasive probes need to be placed inside the brain, which has its own disadvantages and is also not available in all hospital settings in India. The optic nerve sheath diameter is a gold standard non-invasive technique to identify patients with increased ICP because of advancements in the ultrasound technology. Propofol and desflurane, these are two commonly used anesthetics in day-to-day practice, and they have contrasting effects on cerebral physiology. This study aims to compare the effects of propofol and desflurane on ICP as measured by the changes in ONSD and to assess the hemodynamic changes in patients undergoing laparoscopic cholecystectomy. The results of this study will guide us in choosing adequate maintenance anesthesia in patients with occult or known cerebral disease and intracranial tumors. This was a non-inferiority randomized control trial which took place in our department over a period of 1.5 years. All the patients of ASA grade 1 and 2 aged 18 to 60 years who were scheduled for elective laparoscopic cholecystectomy were included in our study. According sample calculation from the parent article study, we calculated at 45 minutes interval the pooled standard deviation and difference between the means, and adding a 10% dropout rate, the total sample size came out to be 146. We took consent of 160 patients, and 11 were excluded at the first stage, and 149 were randomly divided into 75 and 74 groups respectively, out of which 2 patients were excluded in the group B and 1 patient excluded in the group D. Finally, 73 patients in each group were analyzed. The statistical analysis was performed using the unpaired t-test. Patients were randomly assigned into two groups, Group P for propofol and Group D desflurane, by a computer-generated randomization table. Upon arrival in the operating room, standard ASM monitors were applied. Patients were induced according to the institutional protocol. The patients in Group D, they were maintained with propofol, fentanyl, vacuronium and an oxygen air mixture of 40:60. In the Group D, patients were maintained with desflurane, fentanyl, vacuronium and oxygen air mixture of 40:60. Both the eyelids were taped closed with tegaderm. After application of the gel, a linear ultrasound probe was placed on the desired location of each eyeball, as can be seen in the image. The ONSD measurements were taken 3 mm behind the papilla in both the globes in a transverse plane of each eye. These were the time periods. We took total 9 readings. T0 was the reading before induction of anesthesia, T1 at the time of induction, T2 10 minutes after induction, and then thereafter till T7, that was at 10 minutes interval, and the final reading we took at T8, which was in the post-operative ward. Results. This slide is telling us about the age, BMI and the gender of the patients. In Group D, 41% of the patients were males and 58.9% were females. Likewise in Group P, 52 and 47.9% thereafter. These parameters, age, BMI and gender, they were comparable in both the groups. Coming to our main findings, the ONSD. We took ONSD readings of right eye and left eye and the average of those two. The readings at the T0, that was before induction, they were not statistically significant, and thereafter from T1 till the end of surgery till T7, there was a significant result with maximum difference coming out at between T2 to T3, that was 10 to 20 minutes interval. This was the maximum difference. We found the similar readings in the left eye also, as well as in the average of the two groups. Then systolic and diastolic blood pressures were comparable in both the groups and they were non-significant. Likewise, the result for pulse rate and EDCO2, we found the similar results. Moving on to discussion. In a previous study which was published in the Korean journal in 2018, they compared the effects of desflurane and tiva on optic nostril diameter in robotic assisted laparoscopic radical prostatectomy. They had similar results as of us, but the difference was that they included the effect of positioning on their results, and also their sample size was less than the sample size which we took, 146. Another study, optic nerve sheath diameter remains constant during robotic laparoscopic radical prostatectomy in 2014 with a very less sample size of 20. They told that ONSD it remained constant throughout the surgery, so it was different from our result. Then Kim et al. In 2014 did a study on a sample size of 20 patients in which they told that ONSD increased with the effect of positioning. So the study had a less sample size and also the effect of positioning they included. The last study, this is a good study in 2021, one of the recent studies. They compared propofol and sevoflurane in laparoscopic gynecological surgeries. This study was good. They had 110 sample size, but they had a result completely different from the result which we found. They told that during laparoscopic surgeries, the ONSD was slightly higher in the propofol group than in the sevoflurane group. So this is one contradictory statement. Our study had some limitations. We didn't analyze the changes in the ONSD after more than 1 hour because mostly laparoscopic cholecystectomy is a daycare surgery with a short duration of surgery. We didn't analyze the effect of positioning on the intracranial pressure and on ONSD. The effect of ICP in patients with intracranial pathology were not evaluated in this study because we only took ASA1 and ASA2 patients. The findings might vary in patients who had pre-existing disease. So that is an area of interest to be studied. So in conclusion, the study concluded that propofol is a more effective in maintaining normal ICP as indicated by lower ONSD measurements compared to desflurane, which has vasodilated properties leading to increase in the intracranial pressure. This finding underscores the importance of anesthetic selection, particularly in patients with a potential intracranial pathology. Thank you.
Thank you for your presentation. I found your informative when and propofol on the optic nerve sheath diameter patient undergoing laparoscopic surgery.
Yes.
Yes. I have a question. The difference in diameter is gradually decreased as the surgery procedures and what do you think the reason for this?
I think maybe the body strength, the compensatory mechanisms, because of that the readings they reduced.
Compensation mechanism for increased SP.
Sorry, sir.
Do you mean that some compensation mechanisms is the reason for this?
Maybe in the initial, during the starting of the surgery, the MAC might be increased. So the increased MAC, it might increase the ICP more, so and increase the diameter. So as the surgery progressed, or during the excavation time, when we were approaching this, the ICP would have been reduced, leading to a decrease in ONSD readings.
Do you have any questions in Georgia?
I have a question. How long does it take from T0 to T8?
This is a time period T0 to T7 is 1 hour duration.
1 hour.
1 hour. And T8 is the final reading in the post-operative ward. So more specifically T1 to T7 is 1 hour. T0 is just before the induction of anesthesia.
What do you think about the 2 graphics after the T8?
In all the patients in which we studied, the patient had their readings of ONSD, which was similar to the readings which were at before induction. So in this study, we didn't follow up the patients. There might be some changes that could have been a part of a limitation, but as all the patients had similar readings in T8, so we didn't follow up the patients after patients were discharged from the post-op ward.
Yes, thank you for your presentation.
Thank you so much.